Bunion causes and treatment. A bunion is a visible bump formed from an abnormal enlargement of the bone at the metatarsophalangeal joint found at the base of the hallux, or big toe, and the hallux undergoing angulation towards the second toe. Bunions develop over an extended period of time when the joints and soft tissues of the foot are placed under abnormal pressure or subjected to abnormal motion, thereby deforming the joint and displacing the big toe from its normal alignment. Bunions can be caused by wearing shoes that shift weight to the toes with an elevated heel, or create crowding by having a pointed or small toe box, as well as by having certain inherited foot types such as flat feet, foot mechanics such as when the foot rolls too much inwardly during gait, and previous foot injuries or traumas. Bunion symptoms include formation of the bony enlargement or bunion bump, and angulation of the great toe, localized redness, swelling, tenderness over the joint, mild to severe pain, and joint stiffness. Joint pain and stiffness is usually aggravated by wearing heeled shoes and shoes with a narrow toe box. Pain may be more severe during walking, running, or jumping, and irritation to nerves may cause a tingling or numbness in the big toe. Acute stage symptoms are characterized by swelling, redness, pain, and possibly a local sensation of heat, indicating inflammation. If coolness makes your pain feel better, then the acute stage treatment is recommended. Apply the sinew herbal ice on your foot to reduce redness, swelling, and inflammation while dispersing accumulated blood and fluids to help restore normal circulation to the foot. This first aid treatment is used in place of ice to significantly speed up the healing process. It reduces the swelling and inflammation more effectively than ice, allowing you to more quickly regain range of motion. Ice is not recommended because it does not help repair damaged tissues and keeps everything in the injured area frozen, causing the stagnation of blood and fluids and the contraction of muscles, tendons, and ligaments. In Chinese sports medicine, ice is not used and is considered a culprit in injuries that don't heal well. Massage your foot with acute sinew liniment to relieve pain, reduce swelling and inflammation, break up clotted blood and stagnant fluids, and stimulate circulation of blood and fluids to help cells quickly repair damaged tissues. The Sinew Sports Massage Oil is recommended for use before and after exercise, sports, and strenuous activity. It warms and stimulates your muscles, increases circulation, and relieves tightness, hence improving your performance and helping to prevent injury. Chronic stage symptoms begin once the swelling and inflammation are gone, but you still feel pain, stiffness, weakness, and/or sensitivity in cold and damp weather. If heat makes your pain feel better, then the chronic stage treatment is recommended. Massage your foot with chronic sinew liniment to relieve pain and stiffness, strongly stimulate circulation and blood flow to damaged tissues, and promote healing of overstretched tendons and ligaments. Soak your foot with a sinew relaxing soak to relax muscles and tendons that are in spasm, ease joint pain and stiffness, and improve range of motion. The sinew relaxing soak is particularly useful if you feel restricted mobility in your foot. The soak is used by immersing your foot with the soak in a pot of water. The Sinew Sports Massage Oil is recommended for use before and after exercise, sports, and strenuous activity. It warms and stimulates your muscles, increases circulation and relieves tightness, hence improving your performance and helping to prevent injury. Thank you for watching. For more videos, subscribe to our YouTube channel. To learn more, visit sinewtherapeutics.com.